discuss with the physician how this blood glucose is being monitored. Make sure that they understand that the patient may or may not be doing their job as far as keeping the blood glucose under management, and they need to test regularly. There again, my friend who tests once a week, why bother? But if you've got glucose problems, you should know what your sugar is several times a day if you want to keep your body healthy. Sometimes this is hard for older people. There's many issues with an older person and taking their blood glucose. First of all, just getting the meter out and putting that little strip in and poking their finger. The equipment is becoming easier and easier for everybody to use, but having a tracking sheet, you need to know your numbers, and they need to have a tracking sheet so they can see, well, in the morning I'm pretty good, but by the afternoon I'm kind of losing it, and at dinner I'm really out of control. That way they can see the trend, or somebody can work with them to see what the trends are, so that they can maybe figure out what it is during the day that is going on, and why they are not managed as well at certain periods of time during the day. As I said, the glucose meters are becoming easier and easier to use, as well as the glucose sensors. And then I also mentioned that my son has an insulin pump. It's a little machine. It looks like a pager. It's got a little vial of insulin in it, and it's got a tube running from the pump into his body. And he changes that tube site every 3 days. And it's just constantly delivering insulin into his body. There's no denying that people with type 2 diabetes face significant hurdles, and these include increased insulin resistance. Just no matter how much their body's making the insulin, it's not receiving it or accepting it, or the receptors aren't there. Something's going on, and recognizing the symptoms of it. And we've already discussed this about the older people and their symptoms. They can explain away all these different symptoms that they're experiencing. So you just have to keep on your senior, if you're working with a senior who has diabetes or is pre-diabetic, to make sure that they understand what's going on with their bodies. They can be contradictory. Does anybody know what it feels like when your blood sugar's too low? What happens to you? And shaky, and nauseated, all these things. And hungry. Oh my gosh, when I've been hypoglycemic, I'm starving, and I just I want to throw food into my mouth. And those are the same symptoms as high blood sugar. So you have to know what your numbers are. How many times have we heard that on TV for our cholesterol? But you got to know what your blood glucose numbers are as well, including your hemoglobin A1C. Memory loss, coping with diabetes requires a reasonably high level of cognitive, mental function and physical. That manual dexterity is important. Managing those strips and the meter and poking your finger and getting the strip onto your dot of blood that you have. Anybody who has essential tremors, they pick something up and they start shaking. But if you don't have anything in their hand, then they don't shake. It's just the opposite with Parkinson's. With Parkinson's, they're shaking, and then they pick something up and they become more stable. But you can, if they can't see, and so it's very challenging for the older adult who is debilitated. Also, people with diabetes have a higher incidence of dementia and Alzheimer's, and there again, if you keep that blood sugar under control and keep your blood levels the way they should be, the vascular system in the brain isn't compromised. But if it is compromised, you're at very high risk. Does anybody know what telecare is? I would think you guys have heard of this. home health agencies are using telecare more and more often. And what this will do will give the patient equipment. They'll put equipment in the patient's home, and they will be able to monitor their glucose and their blood pressure and their weight. You know, people with congestive heart failure have to be weighed every day. These monitoring systems are placed in the client or patient's home, and they're sent off to a nurse every day who can evaluate what's actually going on at that home. So just think about how that helps with the communication and the readmits into the hospital, how it would decrease those readmits because the problems are caught sooner. It improves functional independence. They actually get to talk with someone who can talk them through their problem. If their weight is too high, they can kind of review what they've been eating. What are you taking your medications? What are your medications? Let me chat with the doctor. They call back. So it decreases clinical visits as well. They have a reduced hemoglobin A1C. That's the HbA1c right there. Their values and their blood pressure and cholesterol, they're all monitored with telecare. How telecare can help is it does dietary teaching and encourages them to eat more healthy choices, because it's kind of like just having a lifestyle coach, isn't it? You know, when you're knowing someone who's on a diet, I wouldn't say that any of us in the room would need to be on a diet, but just having that accountability. And what are you eating? What are your food choices today? Are you going to exercise? But you know what? Having a nurse say, what does your foot look like? Or what do your feet look like? Because people don't look at their feet, and particularly when they can't feel them. So, you know, it's just having someone talk you through, well, today there's a red spot under my toe. Well, if you're going to talk to that nurse again tomorrow, she's going to say, tell me about your toe. And so it's just very, very important to have this telecare education. And certainly exercising, what'd you do for exercise today? Nothing, I sat in my chair. It's just the accountability factor. But it leads to a better self-care and lower health risk. So telecare is becoming more and more important, particularly for the elderly patient, because they can stay home and talk with a clinician daily and have, you know, a better understanding of and taking the responsibility of their own health. Scheduling routine checkups. As we've discussed, diabetes is very difficult and complicated. There's a lot of equipment and, you know, knowing your food choices and knowing that your foot care is important. If you have a senior that you're working with, going to their doctor appointment is very important. And, you know, explaining, you know, I go to doctor appointments with seniors all the time as a geriatric care manager, and even today, how are things at home? Fine. You know, are you having any problems? No, not at all. How are your bowels? Fine. Are you having any problems eating? No. I mean, those are all that's how they answer their questions. Are you checking your sugar? Sure. Nope, none of those things are true, because they don't want to first of all, they don't want to admit that they're declining, you know, and that they're having more trouble. So, because that's the last thing they want to do is, you know, admit that. So it's very important for someone to go with a senior to the doctor's office, and particularly if they have dementia or mental impairment, cognitive impairment, just to make sure that whoever's supervising in the home understands what's important for the glucose monitoring. Diabetes is a puzzle, and I have to confess this screen didn't turn out the way I wanted it to, but let me see if I can. You know, it all starts with the blood sugar. And it's a lifestyle change that can be managed with exercise, weight management, and a proper diet. Most likely, people with diabetes are at a higher risk for getting Alzheimer's and dementia. And frail seniors that are particularly high risk of developing complications from diabetes and can develop serious problems and complications from their diabetes if it's mismanaged. You know, they can end up having a stroke, an amputation, heart attacks. You're at a very high risk. And if you are diabetic or newly diagnosed diabetic, you're pre-diabetic, or you know someone who is, encourage them to stay healthy. And even though it seems like it's a pain and not worth it, it's not worth having a stroke or an amputation either. American Companion Care is our company, and we do offer help in the home, primarily to seniors, but helping people with their diabetes management is important to us. We put this works cited sheet in your packet so that you can take that home with you. Just wanted to talk about a couple more things. Insulin comes in many forms, and it used to be clear and cloudy, and the cloudy was the long-lasting and the clear is the fast-acting. Humulin and Novolog are the most common fast-acting insulins, and they are clear. They will act within 30 minutes to 2 hours are their time frames that they're going to be acting on the sugars in the blood. So that's when people most commonly go into those diabetic comas type thing. That's because their blood sugar has just gone into the tank because they haven't dosed properly. Or, you know, and people who are brittle can't always get that balance just right. But that is the fast-acting insulin is the clear, the Novolog and the Humulin. There are, I think that's right. Then there's long-lasting insulins, and they can last anywhere from 12 hours up to 24 hours. And I think the best insulin made is Lantus, and that is a long-lasting insulin. It works as a basal, and so you inject yourself, and it just takes 24 hours to, you know, it just is a slow-release insulin, and it goes into the system over time and really helps level out the blood sugars. That is what my son's insulin pump is, you know, that's how it's supposed to work, is offer that basal rate. But for a senior, pumps can be, you know, they're difficult to work with. They can't see them very well. They've got little buttons on them. But the Lantus is a good choice for the insulin. And I do think that it's a wonderful choice. And a lot of my seniors that are diabetic, that's the only insulin they have. They are dosed with Lantus once or twice a day, and it manages their sugar just fine. So those are, that's what I have to offer about diabetes. Does anyone have any questions for me?